The CO stands for corona, the V is for virus, and D is for disease.
It's like A, B, C. Hello there, everyone, and welcome to our show, Medicine at All, a show with curious questions and a very interesting answers. My name is Simona, and I got Dr. Rig here, and I guess I would like you to present yourself.
Well, I'm a clinical researcher. I have a PhD in oncology and a master's in immunology, neuromuscular diseases and global health from National University of Ireland, and I have an academic background in clinical medicine and design and implementation of clinical trials. I have been a medical practitioner initially at the start of my career, and then I gradually shifted towards clinical research. Overall, I have more than 8 years of combined experience in oncology.
8 years?
Well, the years fly by, don't they? And oncology and immunology, including clinics, laboratory, and industry.
So we decided to do the show mainly because, few months ago, I was doing my course paper on global health for my program, for my master's. And I didn't really understand the majority of medical jargon that was there. So I came to Rick because I had to Google like every single word almost. So I was like, please explain to me, what does it mean? And he explained to me in such an easy manner, like I was a 5th grader, and I was so happy, and at the same time so dissatisfied with the medical papers, because I was like, medicine is such an important thing to understand, right?
Yeah, absolutely.
And simple people should understand it. So I'm like, why the heck medicine people write it in such a hard way? So that's why this show was born, because I want people to understand hard medical things in an easy way, so that Rick can explain to them better, because he explains it in a very easy way. So this is our first show, and it's going to be, yes, you guessed it, about a very painful thing to us today. And I hate to talk about it, but at the same time, I guess it's the great segment for the first show. So yes, it's about what?
COVID-19.
Yay!
And I do understand, and I do believe that medical research and healthcare needs to be more accessible and understandable by everyone. I mean, I like how you call us medicine people. I think in Latin it would have been medicos. But absolutely. I'm excited for this.
Don't put your Latin things here, okay? I don't understand them. Okay, so we can start with the first segment. And the first segment is me asking you simple questions.
Should I be nervous?
Maybe a little bit, because I don't know if you're gonna understand my simple questions. Okay, so everybody's talking and writing about different symptoms, about different ages, blah, 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 blah. So what is COVID?
And I'm not supposed to use any medical jargon.
I mean, some you can,
Okay.
but like...
Okay, I'll try my level best not to. It's actually quite interesting that you asked this, though, because I recently quizzed some of my medical friends, and they didn't quite...
Medical people, right?
Yeah, medical
Okay.
people, yeah. And they didn't quite know the etymology behind it, because COVID-19, the CO stands for corona, the V is for virus, and D is for disease.
It's like A, B, C.
And it's a disease caused by this new strain of coronavirus. Coronaviruses have existed in animals in our nature for decades now.
Oh, really?
Probably even longer. And COVID-19 was referred to as 2009 for novel, COV. And the disease was SARS, because you have severe acute respiratory syndrome.
You meant 2019. You said 2009.
No, 2019.
Okay.
I 2019 definitely. I was pretty sure it's 2019.
Yeah. 2019.
So it's an infectious disease caused by this newly discovered coronavirus, and most people who are infected with COVID-19 will experience mild to moderate to even severe respiratory illnesses, and most people will recover without any special treatment, just symptomatic treatment, and then older people are, and those with underlying medical conditions are like, it could be cardiovascular diseases, it could be diabetes, any chronic illnesses, previous history of respiratory illnesses, and even cancer. These are people who are more vulnerable to developing more serious illnesses due to COVID.
So now you just talked about age groups and older people being slighter and the bigger risk, right? So how about pregnant women? I guess they're in the more vulnerable state as well, right?
Okay, so just to be very clear, older people are statistically more vulnerable,
Okay.
but young people can still get it. They're less likely to be hospitalized because of COVID-19, but there can be deaths.
That doesn't mean you go partying, young people.
I'm not being preachy here, okay? So yeah, so people in their 20s or their 30s and the 40s can definitely get infected with the virus,
Right.
and some of them could develop severe lasting symptoms, particularly if they had those underlying conditions like obesity, hypertension, previous chronic illnesses, even history of other respiratory illnesses.
But what about pregnant women?
Yeah, I'm getting there. I'm getting
Okay,
there. Yeah.
I'm impatient.
So just to take away the myth that young people can't have it, it's not true, because I think I saw in a recent data published in the US that around 20% of all active COVID cases were actually people from under the age of 30.
Wow.
Now the pregnancy bit.
Okay.
So studies have shown that pregnant women have a slightly higher risk. They can get severely ill with COVID-19, but it does not cause a lot of problems in the newborn, except there's a higher risk of premature birth. So it's definitely important to avoid getting infected or taking like extra precautions. It's definitely recommended. And again, the same risk factors. So if the woman has previous history of high blood pressure or diabetes or obesity and things like that, or previous respiratory illnesses, she's definitely more susceptible to COVID-19. The very important part to notice here is the babies, the newborns, should not be separated from their mothers, because there has been no evidence that shows that COVID-19 can be spread through breast milk. So
Right.
breastfeeding is definitely still very recommended.
And what do you think about herd immunity? I mean, I heard that some countries do it. Is it true?
Is that a question because we're in Sweden?
Maybe, maybe no. I'm not gonna say it.
Okay, if you're in Sweden or if you're from Sweden, pardon my dry sense of humor. Well, I have to explain that herd immunity is an acquired condition, in which a population becomes more immune to an infectious disease, thus preventing the spread of the disease.
Right.
Because they've been exposed so much to that virus, right? Either by vaccinations or to the virus itself. And in terms of COVID-19, I do not intend to be political, but from purely
Try.
but purely from a evidence-based medical point of view, attempts to reach herd immunity are, in my opinion, very unethical, and also I don't think it's very scientific. It's very problematic, from a scientific point of view. So would you really let populations, loads of people of any age or health status, and in different regions, be exposed to the virus and have the suffer from the disease, and then eventually even lead to like mortality, death?
Are you asking me?
Yeah, I mean, it doesn't sound very ethical,
Yeah,
right?
of course. Yeah, no.
Yeah.
It's horrible.
And so I would say that the vast majority of of people in most countries, they remain susceptible to COVID-19, and the testing that has been done has only been able to like cover not the whole nations or whole populations, but and have shown just 10% of people have been infected, on an average in most countries, which is not enough for herd immunity. Plus, we are still learning about how herd immunity or immunity in general against COVID develops. Plus, most people who are affected with it develop symptoms within the first week or two, and then we do not know how long they're going to be lasting.
Right, so it's still very unknown.
Yeah, absolutely.
That's because of that.
Not just that, but
Okay.
also but also people have been affected a second time as well.
Right.
Plus, to give you a comparison, say in measles, 95% of the population had to be vaccinated for herd
Wow.
immunity to work, and we're nowhere close. For polio, I think it was around 80%. 80% had to be vaccinated, so the other 20% would not infect in spite of not being vaccinated. So these are just some of the examples, and in COVID-19, we are far from reaching that, and we also do not know how much of the population need to be infected or be vaccinated, either way, just to be exposed to some of the virus material to grow their immune response and grow their memory immune cells, memory B cells and T cells. So herd immunity is definitely not a solution. It definitely cannot be a primary solution, and definitely not a solution based on any kind of medical science or evidence.
Conspiracy theory. And now there is a vaccine, if I'm not mistaken, right?
There's two. There's more than two. There's 3 vaccines that are already there. Yeah.
Yeah, and so people are getting vaccinated and everything. So how will it help? So do I have to do it every year? Like, people do it for flu?
So a little bit of a little bit of background into how vaccines work. Okay, so different vaccines work in different ways, but with all types of vaccines, our immune system is left with a memory. So they are usually T lymphocytes as well as B lymphocytes that will remember how to fight that specific infection, and it takes a few weeks roughly for the body to produce these immune cells that can help after the vaccination. Therefore, it is possible that a person who was infected with the virus just before or after the vaccination and could get sick because the vaccine did not have enough time to provide the immunity,
Okay.
But there is no way that the vaccine would lead to COVID-19.
Right.
Absolutely no way. And of the vaccines that are there in the market, I'm not sure if I can give out the brand names because we are not promoted, but they have been shown to have 95% efficacy and at preventing both mild and severe symptoms of COVID-19. So this, I think, if I go into a bit more detail, I think the Pfizer one, the study actually showed that the efficacy applies to all age groups beyond racial and ethnic groups and is applicable for both sexes.
We're not sponsored by Pfizer.
No, we're not. Or by Moderna,
No.
the other vaccine there.
Yeah, we're not.
Yeah. The second question that you asked about if you have to take it all the time. I think for these 2 vaccines, you need to take 1 dose and then a booster dose. But then there's one vaccine in phase 3 clinical trials now, and that you could just take 1 shot and would be good. Now, we do not know how fast this virus is going to mutate. So it's very difficult to say at this moment how long it will be effective, because we do not know how long this virus will stay in its current strain, right?
Right. Okay. So I heard a lot about things about COVID and all about like some conspiracy theories that I created. So I wanted to do this, like, I mean, we all hear about myths about COVID, like, about like stupid things that we hear about it. But some of them I was wondering if it's true or not. So how about you be my mythbuster? Because I'm pretty sure you know
Okay.
what is myth, what is reality, right? Okay?
I'm ready. Yeah.
Okay, so
Yeah.
first one I have for you. I heard that you can boost your immune system, like for example with some vitamins or some medications, right? So is it truth or is it reality? Does it mean that I was eating garlic for nothing and scaring people with my breath?
uh, to be honest, garlic, it does have antiviral and anti-inflammatory
Yes.
properties. So so it does definitely help the immune system, and there's evidence for that. But if it will help with this particular virus, probably not. But to be positive here, all that garlicky smell in your breath might keep people away from you. So you're still going to be
That's my goal, because I'm
Yeah.
introvert. So
have like enough physical distancing, if
amazing. So, and I also heard that COVID is just like any other flu.
Yes and no. Yes, because it has similarities with like the influenza, the common cold that we get, like seasonal influenza. But no, in the sense that this is a much more severe form of the disease, and so it's definitely more infectious. There's a lot more cases and pretty high levels of morbidity, like illnesses and unfortunately deaths.
Yeah. So I also heard that temperatures might kill COVID.
We all want that to happen, don't we? To be fair, that was one of those assumptions that a lot of regions and a lot of health authorities worked in. Despite the fact that this virus does not work the best in heat, there has been absolutely no evidence to show that it will be regulated by the environment or climatic conditions, or it has spread actually irrespective of what the temperature has been over the past year or so.
So, okay, is this 5G spread COVID? Okay, even I know it's not true.
What? Okay, that's a first. I have never heard that before.
People say it. I heard people say it.
That is a blatant lie. I mean, I know this can come back to bite me, but I can vouch for this. There is absolutely no relation whatsoever. So please do not fall for such fear mongering.
Yeah, I mean, people can say whatever they want. But I was wondering the other day, I didn't Google this, just for myself. I was thinking, can mosquitoes transfer COVID? Like malaria, for example.
No, malaria is a very different thing. We'll not get into that today.
I'm saying, like...
Yeah. No, there is no evidence that mosquitoes can transmit the virus that causes COVID-19 in humans. In fact, when researchers, they injected a strand of SARS-CoV-2 virus into isolated cells of the... Actually, when you talk about malaria, Aedes aegypti.
Yeah.
Aedes aegypti is the vector for dengue fever and a few other...
Even I know that.
and when they did it, they found that the virus was unable to replicate. So when the virus is in the mosquito, they're unable to replicate themselves, and then and they can't work it out because they need to replicate to grow, right, to get more infected, and they could not.
What if a person with a COVID coughs in a mosquito, and the mosquito flies into another person's mouth?
Very less chances, but then it'll be more from the droplet because it's a droplet infection, right? More from the droplet in his saliva or in his breath, rather than the mosquito being responsible for that.
Okay, that has been cleared out. That's been busted. Okay.
Absolutely.
Okay, so can I go to UV chamber and cure my COVID?
Like an ultraviolet chamber?
Yeah.
Oh Lord, please no, don't do that.
Please don't do that.
Okay. UV, ultraviolet rays, they would cause radiation on your skin. Ooh. And it's very dangerous. And I mean, there is some evidence of UV light being used as a disinfectant in a lab and very selective setting, but definitely not on living objects, living beings.
No, but that's where it's coming from. So that
on surfaces and things like that, yes, there is evidence for that, but definitely not on living beings. Definitely not on living tissues.
Right.
So please don't do that. It's very dangerous. I mean, you don't want to give yourself other very, very dangerous severe illnesses or conditions.
Yeah.
trying to save yourself from COVID.
Yeah. Okay, so now let's move to the last segment of the show, and I'm going to tell you a little secret. Rick is very bad at memes. Like, he can't understand them. I mean, he probably can, but it's in his own style, I guess. So you taught me a lot today about medicine, about COVID-19. I'm gonna teach you about memes, because that's definitely more important, right?
I'm scarred now.
Oh. Okay, so I'm gonna show you the memes. I mean, I've seen them already, and you're going to rate them from 1 to 10. Does that sound good for you?
Yeah, I mean, yeah.
He's not a big fan of memes, but I'm trying to ease him into this meme world, you know? Because as I said, it's definitely important, you know?
I like the payback for all my medical knowledge in memes.
Yeah, it's fair. It's fair. It's only fair.
Life is clearly not fair.
Okay, eye doctor, your result just came back. Can I see them?
Okay, it took me time, but that's a good one. That's a good one.
Eye doctor, probably not.
I would give it 8.5.
8. Wow, that's a fair one. Okay, I would give it a 5.
No, that's funny.
Let me tell you this. I think medical memes are meh. I think it's okay.
I mean, medical memes are probably the only ones that I'll understand. So.
Oh my god.
Sorry.
Okay, it's horrible. Okay, this is related to Corona. So see from... Okay, wait, oh my god, I hate to explain the memes. Okay, so see from the left.
And then to the right.
And then to the right, and then left. And then, yeah.
Okay.
So how introverts think it will be, it's me. Because it is exactly how it is, right?
Yeah.
Oh my god, it's...
This is really funny. I think...
It doesn't show in your face that it's funny.
It's a bit too slapstick. I like more dry and
no, but the last
humor.
one, we experienced this. I mean, nobody punched us in the face, but like...
Yeah,
we've seen people hoarding the toilet.
I think it's a developed world problem, first world problem. It's like, use a bidet, people. Use a bidet, and yeah, I think that's for me a 5. Yeah.
Really?
Oh,
No, yeah, I would give it a 5 too.
yeah.
5 out of 10. Good job. Okay.
Okay.
I think you've seen this one before. I think I showed you once because he did
not
a
sure.
PhD on something related with DNA and RNA, and I was like, what?
Okay, they're called immune responses or genetic predisposition of or genetic expression of immune responses in cancer. So yes, there's a lot of DNA and RNA, and I extracted a lot of DNA and RNA.
Right. So professor says to you, can you show DNA and RNA visually? Me.
It is a very good representation, I think. Yeah, it's funny.
So?
I would. I like medical memes. Okay. I mean, they're
Such a geek.
Sorry. I think I'd give it a 8.
8.
Yeah.
Good one.
Yeah, that's.
Yeah, I would give a 7. I actually chuckled when I seen this one. An apple day keeps a doctor away. Coronavirus. Come on!
Yeah, that's a.
It's a SpongeBob meme.
I mean, SpongeBob is okay, but the meme's not.
I mean, I love SpongeBob memes.
4. Sorry.
You're breaking my heart.
Okay, 5.
Okay, just because you're breaking my heart, it's 5. Oh my god. Okay, I give it 8. I love SpongeBob memes. I'm sorry. It's just I see a SpongeBob meme, I give it a
It
like.
doesn't have layers to it. I like jokes or like fun stuff or like memes when they have like different layers to it. Like it should be like an onion. You peel off a layer and
It's a meme. How many layers can there be?
Many.
Okay.
Okay.
I can't.
I'm being very unpopular today.
You
see?
are. Okay. Dad, I have to stop Dr. Octopus from destroying
This is very funny. Okay, I have to. I have to tell you
I
this.
forgot about this.
I'm not speaking 100% for myself, but for a lot of Indians, I think it's not just even Indians. It's like Asians in general. Like not just South Asians. Even like I would put in like Chinese, the Koreans, probably Philippines as well. A lot, especially kids from not very well-to-do or affluent families. They are pressured to live the dreams of their parents. So, I mean, This is legit. This is a 9.
Why not 10? What will it be to be a 10?
I'm
It
not
has
sure.
stereotypes.
I mean, there's always
It has-
like room for improvement, right? You know, maybe it's a
Right.
better meme, you know, and then what do you do? You know, so 9's great. Come on.
I'll give it a 10. I just forgot about this meme that I had, and it's so funny.
Wasn't it about Rick's rating and not Simona's ratings?
No. It never is.
This is funny.
Okay.
This, if you showed anybody starting off their medical careers, I mean, in medical school, like in the first or second years, they would absolutely love it.
Really?
Yeah, this is very funny.
Okay, so now this fella. What do you think? This is like our last meme.
I think it's really funny. I mean, am I allowed to laugh? Because I mean, my wife is not like that. So, am I allowed to laugh?
I don't know. Okay, are you?
Okay, I'll give it. I mean, there is some truth to it for a lot of people. Probably not in our case. I'd give it a 8.5 maybe.
Okay, I'll give
Yeah.
it a 7 because it offends me. Okay, so with that being said, and with our positive note, we would like to say thank you, and yeah, thank you for watching us. This is our first show, and
Yeah, thank you for watching, because we've mostly done like travel, and I've done like a lot of like purely medical based things, but this is something where we want to communicate medicine in a way that's like more accessible and approachable to everyone, and you can like ask us any questions, you know. So do not forget to like the video and subscribe to our channel.
right,
It's
if you
souvenirs.
yeah, if you want to know some kind of particular question that you want to ask us,
Yeah,
you can
absolutely.
definitely text us or write to us a message
Yeah.
or email, and
Or if there's any topic, you know, lots of love from the both of us. Stay safe, take care of your loved ones, and I think it's very grateful to be respectful and mindful of what we have, and hope towards a better tomorrow, a brighter tomorrow.
you know what I'm thankful about? I get to spend quarantine with this guy. You! I swear to God!
It's like, you know, some payback for all those memes.
Oh my God. Okay. Anyway, see you guys later. Bye.
Stay safe, lads and lasses. Bye.